An accident can happen anytime. It is important that one is familiar with life-saving techniques such as CPR. It can be the difference between life and death. The purpose of this speech is to demonstrate how to properly conduct CPR. I work as a lifeguard at a community pool. We are trained in CPR and recertified once a year. As a lifeguard, I am able to practice and perform CPR on a fairly regular basis, whether it be training or a real-life emergency. I hope by the end of this presentation, you will be able to know the basics of CPR and possibly use it to save someone's life. During an emergency, the first step is to always call 911. Unfortunately, rescue doesn't arrive immediately. While waiting for rescue to arrive, you should perform CPR to the unconscious victim. CPR can either resuscitate the victim, or it can sustain their life long enough for paramedics to perform proper treatment. Before conducting CPR, you first want to go through 3 preliminary steps. These are called the ABCs. The first is A, which stands for airway. You'll need to tilt the victim's head back and check the throat for any objects that are foreign that could be obstructing the victim's airway. If you see something, reach down with your pinky finger and try to pull it out. The next step is B, which stands for breathing. If the airway is not obstructed, then lean down to the victim's mouth and see if they are breathing. You should be able to hear breath coming out and also see the chest rise and fall. If the victim is not breathing and there is nothing obstructing their airway, then proceed to step 3, which is step C, which stands for circulation. To check for proper circulation of the blood, use your pointer and your middle finger to feel the victim's carotid pulse. This is located on the side of their neck, underneath the chin. You'll feel for 10 seconds, and if you feel no pulse after 10 seconds, you'll need to perform actual CPR. The first step in CPR is to breathe into the victim's mouth. To do this, slightly tilt the head back to open the airway. You'll need to close the victim's nose and breathe 2 breaths into the victim. Each breath should be about 1 second long and should cause the chest to clearly rise and fall. The next step in CPR is to compress the victim's chest, which actually pumps their heart and circulates oxygen through their blood. To do this, place one hand on top of the other and place it on the chest of the victim. Then perform 30 chest compressions. Each should be about 1.5 to 2 inches deep, and you should do this at a rate of 100 per minute, so it's quicker than 1 a second. You'll repeat this cycle of 2 breaths and 30 chest compressions until the victim shows signs of consciousness or until rescue arrives. Like I said at the beginning of my presentation, accidents come when you least expect them. All accidents are not preventable, so it's best to be prepared. And the best way to do this is to learn CPR. I hope you take what I have demonstrated and put it to use one day. You may actually be the difference between life and death.